Mr. Speaker, this morning I rise to reaffirm the government's commitment to strengthening Bermuda's healthcare system and accelerating our progress towards the implementation of universal health coverage. These enhancements represent phase one of our UHC rollout, forming the foundation upon which the next phases of reform will be built. As we continue this work, I wish to advise the public that additional details on the coming stages of UHC development will be shared in the months ahead. Mr. Speaker, it gives me great pleasure to announce that beginning in January 2026, HIP and Future Care policyholders will benefit from significant packages of enhanced coverage, including the following. 1 free annual health exam. 2, expanded prescription drug coverage. And 3, removal of the 12-month waiting period for the personal home care benefit. These reforms directly advance our national goal of achieving equitable, affordable, and accessible care for all. Mr. Speaker, the introduction of 1 free annual health care visit for all HIP and Future Care policyholders marks a transformational advancement in preventative care. These physical examinations, reimbursed at 100% to the providers and at no cost to patients, are expected to range between $250 and $350 depending on the patient complexity. This investment is not merely a new benefit, it is the cornerstone of UHC. The benefits of annual health exams expand access to routine and preventative care, reduce disparities in health outcomes, support early detection of disease, and improve the management of chronic conditions. Common conditions such as hypertension and diabetes, which affect many in Bermuda, can be effectively managed through primary care. Early intervention reduces complications and lowers long-term system costs by preventing avoidable emergency visits and hospitalizations. Mr. Speaker, this shift from treating crises to preventing them will help reduce the persistent pressure on the emergency department and move us closer to a sustainable, patient-centered model of care. Mr. Speaker, I am equally proud to announce sustained and substantial increases to prescription drug coverage, another pivotal, critical pillar of UHC. HIP coverage will increase from $1,000 to $3,000 annually. Future Care coverage will increase from $3,000 to $5,000 annually. This enhancement directly addresses rising medication costs and ensures that Bermudians are not forced to choose between financial security and the medications they need. Access to prescribed medication is central to chronic disease management. When people can afford their prescriptions, they are far more likely to adhere to treatment regimes, leading to better health, fewer complications, and reduced need for costly hospital care. By eliminating financial barriers to essential medicines, we are strengthening health outcomes and protecting our health system from avoidable strain. Mr. Speaker, more good news. Effective January 26, HIP and Future Care policies will gain immediate access to the personal home care benefit, with the 12-month waiting period heretofore being removed entirely. The PHC benefit, which is capped at $60,000 per year based on medical assessments, enables seniors and individuals with chronic conditions to receive in-home care services and adult daycare support. This improvement supports aging in place. It relieves hospital congestion by enabling timely discharge for medically fit patients and provides care that is both more cost-effective and more compassionate than institutional alternatives. Mr. Speaker, to support the dedicated caregiver workforce that enables the home-based care, the hourly reimbursement rate will increase from $15 to $17.13, reducing the out-of-pocket cost and expenses for HIP and Future Care participants and their families as the employer of the caregiver have had to cover in order to ensure compliance with the minimum wage legislation, which is promoting a workforce stability. Collective impacts, progress towards universal health coverage. Mr. Speaker, collectively, these enhancements represent a substantial and meaningful advancement towards universal health coverage. They expand existing benefits in ways that prioritize prevention over crisis care, reduce financial barriers, strengthen primary and community care, promote medication adherence, and support home-based services. These reforms help ensure that the people of Bermuda can receive timely, high-quality care when and where they need it without the fear of financial distress. This is how we build a fairer, stronger, and more resilient health system for future generations. With respect to financial sustainability and strategic vision, Mr. Speaker, by increasing and investing in primary care, medication access, and home-based services, we are improving health outcomes while mitigating financial pressures that threaten the sustainability of Bermuda's health system. These measures are not isolated actions. They form part of health system strengthening to stabilize costs, improve access, and strengthen the health system's resilience in the face of demographic and economic challenges. Mr. Speaker, let me assure our community that the government of Bermuda remains firmly committed to building a health system that works for everyone, a system rooted in prevention, equity, and financial protection, a system that advances universal health coverage, and a system that guarantees that every person in Bermuda can access the care they need without falling into financial hardship. Thank you, Mr. Speaker.